Hi, I'm Dr. Nawaz Hussain bin Mohamed Amir from KPJ Ipoh Specialist Hospital. Today, in conjunction with the World Cancer Day on the 4th of February, I would like to share a few moments regarding cancers that involve musculoskeletal system. I deal with cancers of the muscles, bones, skins, and also vessels, as well as the nerves of the upper limb and the lower limb. Currently, there is increase in the number of cases regarding the cancers of the upper limb and lower limb all over the world. But with early diagnosis and complete treatment of the disease, the outcome and prognosis of the patient is also having better chance and better every day. At this point, we have developed such a great advance in medical management as well in surgical management in cancer, and yet we get more and more cases every day. My specialty is in orthopedic oncology that will be presented by cases whereby most of the patients are in young age group, which is about 5 to 15 years old, and some in young adults. And mostly they present with bone cancers. Bone cancers are the cancers that develop from inside the bone or the medullary canal, and they emerge outside. There are a number of types of orthopedic oncology cases, such as the most common ones are osteosarcoma, Ewing sarcoma, and also chondrosarcoma. Apart from that, there are also some cases where we have cancers of the soft tissue, such as cancers from the muscle, cancers from the fat tissues, cancers from the nerve, and also from the blood vessels. We also deal with that. The number of cases that we see year by year is increasing, and also we would like to tell you that there is a solution for all these cases. Previously, about 10 to 15 years old, especially in Malaysia, when the diagnosis of musculoskeletal cancer is made, most of the cases end up with some amputation and also death. But nowadays, due to the advent of the medical specialties such as medical oncologists and also surgical treatment, there are a lot of cases that has been doing very well for so many years, in which we conclude that this patient has been cured of cancers. And due to this, this is why we as doctors would like to tell you that there's always solution for any kind of disease, especially for cancers. We have cases where when we diagnose the cancer, they disappear from our radar and they come back many months later with a lot of complication. However, nowadays with advance of very good radio imaging such as CT scan, MRI, PET scan, as well as very good surgical instruments that I will explain later, the number of patients going for pure cure of the disease is increasing day by day. At the same time, the number of cases that we see is also increasing. So we have to teach our patients as well as the general public about the awareness of these kind of cases, which can be dealt accordingly. For example, this case where is a 16-year-old Malay boy who came with the as you can see, there's a big tumor on the left distal femur, and this patient correctly has undergone proper treatment with us and with biopsies and the proper imaging and subsequently chemotherapy as well as surgery, which end up with very good outcome, whereby we can see his leg is fully functional after 4 years and the patient is active and alive, and he's currently considered cured of the left knee osteosarcoma. This story can be replicated in so many cases, and inshallah it also can be done for so many cases, provided the patient comes early and they get early treatment. So I would like to suggest that all patients who have some queries about whether it is a cancer or not a cancer, just go to proper orthopedic surgeons or any orthopedic oncologist to come early, get diagnosed. If it's a cancer, don't be disheartened. There is a cure for you. Thank you very much.